today we're going to talk about alternative payment models under Medicare. So some of these, two of the ones we're going to talk about are bundled payment models. They include the CJR, which is the Comprehensive Care for Joint Replacement model, and then the Bundled Payments for Care Improvement, or the BPCI. So just a little background on the CJR. So it began April 1st, 2016, and then it's going to run for 5 years. Basically, it bundles all total hip and knee replacements in a bundle for designated metropolitan areas, and that it includes inpatient stay and post-operative care up to 90 days after discharge. All providers are still paid under the fee-for-service model, and then hospitals then can share reconciliation payments and internal cost savings with other collaborators, which could be physicians, home health agencies, SNFs, and then physician group practices or therapy practices. So more about the CJR. So there are required measures then that people have to complete. So the complication rate following elective primary like total hip replacements and total knee replacements, and then the HCAHPS survey measure. Those are required under this bundled model. Optional measures then include like the HOOS and COOS, which are like outcome measures for the knee and the hip, or the PROMIS Global or VR, which is the Veterans RAND. And then to learn more about this, there's an APTA has put out a webinar, and it's free for all APTA members, and that just gives you a little bit more about the CJR and how to do it. The CJR expansion, so they are looking to expand this bundled payment model. In 2017, Medicare physician fee schedule proposed to include all hip and then femur fractures. This includes a mandatory bundle program for care associated with cardiac bypass surgery and heart surgeries as well. So now it will not only include just total THAs and TKAs, but also this cardiac surgery, heart surgery, and then hip and femur fractures as well. So now we're going to look at the BPCI, which is another bundled payment model. So this is their pilot programs to address the triple aim of healthcare, which we've talked a lot about. So the cost, quality, and access. It's comprised by 4 models of care. They link payments for multiple services that the beneficiaries are receiving during their entire episode of care. So this just incentivizes providers and suppliers to coordinate their care more efficiently. And we'll see what that kind of looks like here in a second. So BPCI, like I said, has 4 different models. So we'll just kind of take a look at each of these models in a very brief way here. So model 1 is for acute care and hospital stays only. It covers all diagnosed related codes. So all DRGs are covered. And then 32 hospitals are currently participating in that model. Model 2 is acute and post-acute care. It's chosen from 48 possible clinical episodes. So there's like 48 possible DRGs that the hospitals could choose from. And 472 awardees are currently participating in that. And now Model 3 is post-acute care only. It's chosen from, again, those 48 possible clinical episodes or DRGs. And then just 663 are currently participating. Model 4 is acute care hospital stay only. 2 awardees are currently participating, and then that's also chosen from 48 possible DRGs. And then the hospital chooses those. What are some pros? So now we've looked at kind of the background of these bundle payments. So what are the pros of these? So basically more businesses and more revenue, more referral generators. It's possible for profit sharing, facilitates collaboration with the care team. Like I was saying, that BPCI really helps, it incentivizes that effective collaboration between providers, encourages data collection, especially like you saw with the CJR, how they include the HCAHPS survey, and then some other things are the HOOS and COOS that you can use. And then it just demonstrates the value of physical therapy, so that is great for our profession. And then this is just looking more into these bundled payment models on the APTA website. The APTA came out with a statement on the transitioning to these bundled payment models. So in January of 2015, the Department of Health and Human Services announced its plan to move aggressively on its goal to transition 30% of the traditional fee-for-service Medicare payments to these alternative payment models, or these APMs, which is such as the CJR that we talked about by the end of 2016, and then 50% by the end of 2018. So basically, as a PT, we need to start looking toward the future, because 2018 is here, and 50% of the fee-for-service models are going to be changed to these bundled payment models. And then again, like I said earlier, for more information on this, there's a lot more bundled payment models and alternative payment models under Medicare. So just to be more familiar with these, going to the APTA website, they have more information on alternative payment models. They provide a great resource for us.